All right, before we begin, just a quick reminder that if you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today. It is 10:01, so I will go ahead and hand it over to Dr. Vanderhoff so that we can begin.
Well, good morning. I'm Bruce Vanderhoff, the director of the Ohio Department of Health. And as we meet this morning, we're on the threshold of a long-awaited step that brings us ever closer to getting through this COVID-19 pandemic. Thanks to the authorization of a COVID-19 vaccine for those ages 5 to 11, we can now better protect these school-aged children from severe complications from COVID-19. This vaccine is something that children and so many adults, parents, guardians, grandparents, aunts, uncles, pediatricians, teachers, and coaches have all long awaited. COVID-19 is, as we know, a deadly virus that has claimed the lives of more than 24,000 Ohioans and has caused more than 206,000 infections among those less than 18 years old. Indeed, according to the American Academy of Pediatrics, as of October 28th, nearly 6.4 million Americans younger than 18 have had COVID-19. Now, while it remains true that children are less likely than adults to get severely ill from COVID-19, they most certainly can and do become ill, even seriously ill, and can suffer lasting complications from the virus. As of November 1st, more than 2,000 Ohio children under 18 have been hospitalized with COVID-19 and 15 have died. Nationally, the virus has taken the lives of almost 800 children. We know that the existing COVID-19 vaccines have been remarkably effective in preventing severe cases of COVID-19 that result in hospitalization or death. This includes the Pfizer vaccine, which has been fully approved for those ages 16 and up. To date, more than 247 million doses of the Pfizer vaccine have been administered in the United States, and a smaller dose of this same vaccine, 1/3 of the adult size, was thoroughly tested in clinical trials with 3,100 healthy youth participants who received the vaccine. That clinical trial showed that the pediatric formulation, which is 10 micrograms, and that compares to the adult and adolescent dosage of 30 micrograms, was almost 91% effective at preventing symptomatic infections during that clinical trial. Clinical trial, which of course was conducted when the Delta variant was widespread. So this is a remarkable level of protection. Safety, of course, was of paramount concern to both the FDA Advisory Committee and the ACIP. During the clinical trial for those ages 5 to 11, no serious side effects were detected. In particular, we know parents are concerned about the rare adverse effect of myocarditis and inflammation of the heart muscle. And you may recall that this rare risk was identified for vaccine recipients 12 and older, albeit a risk that most recover from on their own. It's in fact more likely for myocarditis to occur after being infected with COVID-19 than it is after someone is vaccinated. But it's important to note that in the clinical study of those 5 to 11, none of those children who received the vaccine experienced vaccine-related myocarditis. To date, more than 386,000 Ohioans ages 12 to 17 have started the COVID-19 vaccination process, over 43% of those in that age group. It remains very clear that COVID-19 vaccination is the best protection for all Ohioans, including youth. One poignant illustration is that recently, a few of our children's hospitals anecdotally shared with us that all of those children hospitalized in their facilities with COVID-19 who were 12 and older, and so vaccine eligible, were in fact unvaccinated. Our recent data shows that among all ages, 95% of all COVID-19 hospitalizations from January to the present were among those who were unvaccinated. And 96% of all COVID deaths were among those who were also not vaccinated. COVID-19 is still a very serious public health threat. Despite a downward trend, Ohio's COVID-19 cases remain very high. Last week alone, between October 25th and the 31st, there were nearly 19,000 people who tested positive for COVID-19. Of those, nearly 3,500 were under age 18, about 18% of all cases in the state last week. Although all COVID-19 cases and pediatric cases are both lower than the previous week, we're not out of the woods. Now, we are thrilled that a COVID-19 vaccine is now available for younger school-aged Ohioans. But let's remember that vaccine protection doesn't come instantly. As we know, it takes about 5 weeks to achieve full protection. You get the first dose, that is followed by the second dose 3 weeks later, and then your body mounts maximum protection about 2 weeks after that, so a total of about 5 weeks. It's still incredibly important for students, parents, and schools, therefore, to be thinking about the importance of masking, as the vaccinated children will not be fully protected for some weeks to come. So, as parents and families think about important dates this winter and the holiday season, they should count backward to ensure their children are going to be protected. For example, if you count 5 weeks back from Christmas, a child who wants protection for the Christmas holidays should really have their first dose no later than November 20th. Until your child gains maximum protection from the vaccine, we continue to encourage students to wear masks in school as we await the rollout of this vaccine for our younger students. Now, over the last several weeks, we've been working closely with providers to prepare to distribute this very important vaccine, which will be available in all 88 of our counties. During the initial rollout of COVID-19 vaccines for those ages 5 to 11, a total of more than 367,000 doses are expected in Ohio. And this includes more than 250,000 ordered by providers through the state's allocation system, and more than 115,000 ordered by pharmacies through the federal retail pharmacy program. The first shipments of the pediatric formulation have in fact already arrived in Ohio, with additional shipments arriving on a staggered schedule over the coming days. Ohioans will be able to make an appointment with many different types of providers, including local health departments, pediatricians, family physicians, community health centers, adult and children's hospitals, and of course, pharmacies. Ohioans are encouraged to call their provider for more information. You can visit gettheshot.coronavirus.ohio.gov, or you can call 1-833-4-ASK-ODH and make an appointment or locate a provider. When visiting the website, you'll be able to enter the patient's age to filter information so they can find information on those providers who are in fact administering the pediatric vaccine. Finally, we're officially expanding the Ohio Vax to School program for those ages 5 to 25. Ohio Vax to School will reward $2 million in scholarships to eligible Ohioans. And prizes include 150 $10,000 scholarships and 5 $100,000 grand prize scholarships. We have a series of registration deadlines, and to be eligible for all prize drawings, you should register as soon as the first dose of the vaccine has been administered, ideally by the initial registration deadline of Sunday, November 21st. There will be 2 drawings for the $10,000 prizes, one on November 22nd and another on November 29th. If you register later, by Sunday, November 28th, you'll only be eligible for the second drawing. To be eligible to win one of the 5 $100,000 grand prizes, you'll need to register no later than Wednesday, December 1st. Winners will be announced daily the week of November 29th through December 3rd. The bottom line is, the sooner you register, the better chance you have to win. Ohioans ages 5 to 25 or their parents or guardians can enter online once they have received at least 1 dose of the COVID-19 vaccine. And of course, that our website is www.ohiovax2school.com. Well, today I'm joined by 3 physicians to talk about the impact of COVID-19 and the newly authorized COVID-19 vaccine for children ages 5 to 11 years old. First, I'm joined by Dr. Michael Forbes, pediatric intensive care specialist at Akron Children's Hospital. Dr. Forbes, thanks for joining us again today. We know that children tend to have more mild cases of COVID-19 than their adult counterparts. However, that doesn't mean they're invincible. Unfortunately, we know they can still suffer from severe consequences or even death. Can you tell me a little more about the risks of getting COVID-19?
Sure, Dr. Vanderhoff. Thank you again for having me. This is a terrific pleasure. And I celebrate with you this day, this moment, where we finally have an option, a vaccine option for children 5 to 11 years old. We remember that first wave of COVID. We felt lucky in pediatrics because it skipped children to some degree. We felt like it did. The Delta wave is different. And we have seen severe disease in children, and really highlights the need for vaccination. You've gone over the numbers. They're pretty compelling. And while those numbers may seem low to some people, I can tell you, caring for and ministering to families in the ICU, seeing them in the emergency department, only one is what's needed to really have an impact on a family and on a community. And so thousands and thousands of children have in fact been affected. Remember that the purpose of vaccines is to prevent severe disease. And really the goal is to improve community health. And so I'm thrilled that we addressed and took care of our elders first, and in a systematic way took care of our non-elder adults. Then we took care of our 12 to 17-year-olds. And now we didn't copy and paste the study and just do the same thing in 5 to 11-year-olds. We use science and realize that we can be very effective with a lower dose, with less side effects, frankly, almost no side effects for children 5 to 11, and really take care of them so that not only will we not see those consequences of natural infection, but really confer vaccine immunity to 5 to 11-year-olds, spare them the consequences of this terrible infection, and raise community health. I think it's a fabulous moment for everyone.
Thank you. Thank you so much. You know, COVID, of course, is a big part of our concern this winter for our children. But the winter respiratory viruses are more than just COVID, right? There's COVID, we have RSV, and of course, every year, the flu. What advice can you offer families about how they can best protect their families from these winter respiratory illnesses?
No, great question. so we're anticipating RSV, flu, COVID, of course, rhinovirus, and all of the kind of the usual suspects of winter viruses that show up every year in a predictable way. COVID does change things. I think that what we learned in 2020 is in the pre-vaccine era, we know what works. The toolkit works. There was a bit of controversy, of course, early on around masking. Does it work? Does it not work? At this stage of the game in November 2021, it's a no-brainer. It's a non-issue. Wear your mask when you're around other people. Get vaccinated now that we're in the vaccine era. Keep your distance. Keep your hands clean. Avoid large groups. So we know what works. And we now have a vaccine. And so, I think this is just such a terrific time to be able to really kind of turn the corner on this pandemic and get a little more control over the spread. And so I'm looking forward to seeing the 5 to 11-year-olds get their vaccines.
Yeah, and this well as a physician who practices in a children's hospital, that all along the picture has included real concern about what the overall impact of these respiratory viruses making children very, very sick might have on our hospital beds, and the ability of our hospitals to really have the room, really have the capability of caring for other illnesses as well, including simple things like a fracture from falling on the ice in the winter.
Yep.
Can you tell us a little bit more about why it's important for us to take common sense steps now so that we help alleviate the risk of severe pressure on our children's hospitals this winter?
No, absolutely. Thank you for asking that. We've learned a lot from, again, 2020 and the value of the toolkit. What we're really talking about is community health. And our healthcare system is a shared community resource. And so our individual decisions have an impact on the availability of that shared community resource. We have some hard facts in healthcare these days. We lost over 500,000 healthcare workers in 2020. They didn't go from one hospital to the other. They left healthcare altogether. And so we have had to innovate throughout the country and certainly in our state, collaborating with our partners throughout the region to make sure we can still deliver high quality care. The way that we can continue to move in the right direction as a community to preserve and elevate community health is to make sure we're doing the things we know to do. I'm very aware of the fact that public health really starts with private choices. And so I really, really I can't beg anymore to really make the right choice when it comes to exercising all of the elements of the toolkit, right? Keeping your distance, washing your hands, getting vaccinated. And again, thank goodness we now have a vaccine for 5 to 11-year-olds that can really begin to contain the spread so that we can have capacity to do the things that a high quality healthcare system like ours in Ohio is capable of doing. And we're not overrun with preventable disease.
Thank you so much. Thank you so much, Dr. Forbes. Next, I'm joined by Dr. Patty Manning-Courtney, pediatrician and chief of staff at Cincinnati's Children's Hospital Medical Center. Dr. Manning, the Gamble Center for Vaccine Research at Cincinnati Children's has in fact taken part in COVID-19 vaccine trials. And it's my understanding that more than 350 children have been a part of these trials. Can you tell us a little bit about what you've learned through this process, particularly in terms of the confidence that parents can have about vaccine safety and the effectiveness of the vaccine for this new age group, 5 to 11 years old?
Thanks, Dr. Vanderhoff. And I just want to echo the enthusiasm and the celebration that we're feeling here in pediatrics and at Cincinnati Children's for the ability to vaccinate this age group now. We are very proud to have participated in these vaccine trials, and we're proud to have had children in our region, in our own neighborhoods, participate in these trials. And from them, from those children and from these trials, we've learned that this vaccine is incredibly efficacious. It works. It is very effective at preventing disease, and COVID is now a vaccine preventable disease. The other thing we learned about the side effect profile, interestingly, is that the side effects are really quite similar to those that were reported in adults, but in children, they're actually less frequent and less severe. And I don't know if that means that children are more sturdy. I suspect that that could be the case, but children have tolerated this vaccine very well, and they have benefited. So it's safe, it's effective, and it's the right thing to do.
Thank you very much. Now, we know that parents, when it comes to their children, are really only concerned about what's best for their children. And there can be concerns about something new, especially a vaccine. And I know I've heard parents express concern about longer term potential consequences. What about fertility for my child down the line? What about what I've heard about myocarditis and pericarditis? Can you speak to those concerns that parents may have as they're contemplating this newly approved vaccine for their children who are 5 to 11 years old?
You know, I have great respect for the processes that families go through, parents go through when they make decisions on behalf of their children. They are the stewards of their children's health. And so, we greatly appreciate the thought that they put into these serious decisions. And so it's with great confidence that I can say that some of the concerns that have been raised about vaccines, and I'll speak first to fertility. The short answer to that question is no, there's no impact from these vaccines on fertility. It's sometimes an unsatisfying answer to give, because the seeds that were sown around this risk were based in some very incorrect science. And so to simply say it's wrong, that's not true, sometimes doesn't feel robust enough to some families. But physician after physician will tell you that's simply untrue. There's no evidence whatsoever that fertility is affected by these vaccines. The second issue, you already spoke to myocarditis. It was not seen in our cohort of vaccine trial participants, which was great. Even when it is seen, it's very mild, and it is 6 to 7 times more commonly seen when you get COVID. So if you're worried about myocarditis in your child, you don't want them to get COVID. And if you don't want them to get COVID, you want them to be vaccinated, and the risk of myocarditis is exceptionally low. And then the third item around long-term effects, we hear this a lot about this new vaccine and that there's not been enough time. But we know 2 things about long-term effects related to COVID and the COVID vaccine. We know that vaccine side effects happen within the first 6 weeks. We know this from the COVID vaccine being administered to billions of people worldwide now. And we know this from other vaccines, that vaccines don't live in your system long term. They go away, they do their job, they stimulate your immune system, and then they go away. We also know for certain, we've seen it directly, that children can have long-term side effects from COVID. So if you're worried as a parent about long-term side effects, you really should be concerned about the risk of COVID. Even mild COVID in a child has the risk of long-term side effects. The vaccine does not. The vaccine will prevent that risk of long-term side effects from COVID.
Dr. Manning, I'd like you to elaborate a little bit further on that point that you're making, because it's one that I hear from caring parents all the time. And it's that, well, my understanding is, doctor, that most children get a relatively mild case of COVID if they get COVID. Aren't I better off letting them just get that mild case and get through it than I am subjecting them to this new vaccine? What's the response that you would offer a parent who's having that concern?
My first response to that is that it feels like an unnecessary risk to take, that your child would get COVID and that you're banking on it being mild, when in fact we've told you many times that we see children every day, including today at Cincinnati Children's Hospital, hospitalized with moderate to severe to quite serious COVID. And we can't tell you who that child will be. So you may gamble that your child would get mild COVID, but nobody could guarantee that that would be the case. They don't necessarily have to have pre-existing conditions. Some of the pre-existing conditions that do increase the severity of COVID are very common, things like asthma and obesity. And so going the route of sort of natural immunity or let them just get the disease feels like a risk to take with your child when we can tell you confidently that this is a vaccine preventable disease. And vaccines have prevented diseases and death in so many children in other ways. And COVID is causing many deaths. You gave some striking numbers earlier in this call about the number of deaths that we've had from COVID in children. So I would say that the risk is far greater if you want to take the chance of your child getting COVID than from the vaccine.
Thank you, Dr. Manning. Well, finally, I'm joined by Dr. Michelle Dritz, a pediatrician at Cornerstone Pediatrics in Miamisburg, and a delegate at large to the American Academy of Pediatrics for the Ohio chapter. Dr. Dritz, we know, and Dr. Manning just outlined this, that vaccines are an important part of keeping our children healthy, and that regular childhood immunizations, and I'd include the flu shot, can really make a difference in terms of saving lives and improving their health. The COVID-19 vaccines, of course, can be given at the same time a child gets a flu shot or another vaccine. Can you share with parents a little bit about why it's important to not let our children get behind on their shots, why it's important to stay up to date with those shots, and maybe be thinking about that when they're thinking about getting the COVID vaccine for their child?
Yes, thank you, Dr. Vanderhoff, for having me. I think that what we've already heard from Dr. Forbes and Dr. Manning emphasizes that point. I mean, vaccines, not just our COVID vaccine, but all the vaccines that we have available do a wonderful job of protecting our kids from all sorts of preventable illnesses, and unfortunately illnesses that for some people can be deadly. So the more that we can make sure that we're getting our kids vaccinated both against this preventable COVID infection, as well as for all the many other preventable infections that luckily we don't see as much today because of the effectiveness of vaccines, the better. And I think after coming out of and continuing to be in this pandemic now for almost 2 years, we've seen a really significant drop in children getting many of the normal preventable vaccines that they've been getting over the years. And so we're in catch-up mode when it comes to their typical childhood vaccines, as well as now moving into this next phase wonderfully of having something that helps us prevent the COVID infection.
I think that it's probably fairly evident to those who are participating in this briefing that we've got 4 doctors who are all very, very excited about the advent of vaccination for this age group. But, you know, this is an age group that has been adjusting and learning to deal with the virus in so many ways, whether it's doing more with hand hygiene or sneeze etiquette or wearing masks in school. Can you just share a little bit with the parents and families about why this vaccine for this age group is something that makes physicians so excited, why we're so pleased to see the advent of the COVID-19 vaccine for 5 to 11-year-old?
It's a game changer. I mean, of the many things that we know that can help protect us against any sort of illness or infection, especially the effectiveness we have seen with the COVID vaccine in the adults in the teenage range in terms of reducing complications, hospitalizations, death, and even infection. And as to Dr. Manning's point, even sometimes mild infection, we are seeing long-term complications with our kids and with our teenagers. So anything that allows us to really maximize that ability to protect our kids, I embrace wholeheartedly. And the COVID vaccine definitely is one of those. It certainly still goes hand in hand with the many other ways that we know have been effective in helping us fight against the coronavirus, like masking, like hand washing, like distancing, and trying to minimize how many people are around at one time. But hopefully, the more we're able to get our community vaccinated, the more we'll be able to pull back some of those other protective factors because of the vaccine's effectiveness in helping protect all of us, including our kids.
You know, parents really trust their child's doctor and routinely come to them with questions about their child's health care. I'm sure you're fielding, along with your colleagues, questions all the time about COVID-19, and especially now about the vaccine. Is there a specific, or is there a message or a theme that you're encountering frequently that you'd like to share with parents who may have some concerns about the virus and the vaccine?
Well, I mean, I just really start off that conversation asking them what questions they have. Because at the end of the day, and I tell this to my families and to all the parents and the teens and the kids that I see, I wouldn't recommend anything I wouldn't do for myself or for my own kids. And this is a vaccine that I've seen the research, I've watched the science, and I know it is both highly effective and safe. And that gives us just one more tool in our tool belt to help keep our children safe. And as parents, that's all we really want to do. Especially to Dr. Manning's point, if we're, as parents, if our goal is really to try to minimize the risks, to try to keep our kids as healthy and safe as possible, well, then we see now that the vaccine helps us do that much better. So please join me in getting our kids vaccinated.
Thank you so much, Dr. Dritz. Well, we know without a doubt that vaccines really do save lives. They've protected us for years from diseases that thankfully are now incredibly rare. Diseases like polio, measles, and mumps. Now, the COVID-19 vaccines can help us better protect our school-aged children and prevent them from becoming seriously ill or bringing the virus home to younger siblings or even older family members. This is a crucial turning point that I think you're hearing, we believe, will allow us to come closer to the end of this pandemic. And now I think we're ready to take questions, Alicia.
Thank you, Dr. Vanderhoff. Our first question today is from Joe Ingles with Ohio Public Radio and Television.
Hello, doctors. Thank you for doing this. My question is, since the updated guidance on quarantine last week, and now that the vaccine is coming out, we are starting to see public school districts that were mandating masks in classrooms, backing off of that and saying, hey, we don't need the mask mandate anymore because if someone is COVID exposed, the new quarantine guidance is that they have to wear a mask. Are you concerned that backing off of the mask now in these schools before the vaccine is able to take effect might actually cause more problems in the school district? And what are your thoughts about that?
Well, I'll begin and then I'll certainly turn to my colleagues. Thank you for that very good question. I think the message that we're offering here is very clear. There's hope. We are seeing light at the end of a very long tunnel. And I think it's good that all of us are feeling upbeat and feeling that sense of hope. But the truth is, as I said earlier, we are not yet out of the woods. As we look at the cases of COVID-19 that are rising every day in every community across our state, they're still very, very high. Are they beginning to come down? Thankfully, they are. But they're still at very, very high levels, which means the risk of spread remains very, very high. And as I shared, it will be some time, even with robust uptake of the vaccine, before we have substantial numbers of our school-aged children who are fully vaccinated and therefore fully protected. So I think that we need to remember the common sense safety measures that all of us have spoken to, and I think especially Dr. Forbes spoke to, in terms of the importance of continuing to wear masks, wash our hands, avoid close contact with others when we can, and not lose sight of the fact that, yes, we're approaching the end of the tunnel, but there's still more of our journey in front of us. Let me turn to my colleagues. Maybe I'll begin with Dr. Forbes and just give them an opportunity to comment on this important question. Dr. Forbes?
Sure, thank you. Great question. You know, I think it gets back again to community health. And the way I look at the masking question in schools is why was the mandate there in the first place? And the mandate was there in my mind because the community prevalence was high. And so when community prevalence is lower, that's the threshold to consider the mask mandate or retracting the mask mandate. If the community prevalence is high, then you just have to wait. You know, I think, again, I can emphasize what you just said, Dr. Vanderhoff. We are right at, we're almost there. You know, we had 37. I read about this and I've talked about this before. We had 37 summers of polio before Jonas Salk in Pittsburgh came out with the vaccine and his team. And then Dr. Sabin in Cincinnati came out with another polio vaccine. 37 summers. We're almost 22 months into this. We can do this. I say just wait, give it a few more weeks, few more months till we have enough penetration of the 5 to 11 vaccine, and then we can see the numbers go down. And then, we can look around and maybe declare an all clear at some point. But that's the reason for the mandate in the first place, is that it's still in the air. You don't take it away because the numbers appear to go down for a moment.
I'll turn to my other two colleagues. Anything that you'd like to add? If not, we'll move on to the next question. All right. I think we can move on.
Our next question is from Max Filby with the Columbus Dispatch.
Yeah, good morning, doctors. Given that this vaccine for 5 to 11-year-olds is shipping separately right now, I'm curious if you're anticipating any shortages or supply or logistics issues in the coming weeks for this vaccine. Thanks.
So this is Bruce. I think I'll field that question primarily. The numbers I shared are really substantial numbers of vaccine that are coming into the state this week. We're looking at, when you put it all together, a number that's approaching 400,000 doses. That's for a population that's less than 1 million. So I don't think supply is very likely to be our concern here. I think that there's going to be ample opportunity for people to get this vaccine in a timely way. Now, in the first days of the rollout, it's entirely possible that you may be seeking to get into one location or another and have some difficulty. But as we look at the first week or two, I think there is going to be a substantial and a very satisfactory supply here in the state. And Dr. Manning, I know, with your work and your institution's work around vaccine development, I don't know if you have anything you want to add to that.
It's a fair question, because early on in the pandemic, there were, some fits and starts in some of the supply chains for vaccination, but we feel very confident now. We're in a very different place. Many of the clinics, including our own, have received our vaccines already. The state was really planning ahead this time and saying, hey, even before their approval, let's get things going. And so I think we're in really good shape.
Thank you. Our final question that we have in the queue, I apologize, we actually have 2 more questions remaining. Our next question is from Mike McCarthy with WSYX WTTE.
Good morning, doctors. Thank you very much for making yourselves available. If you'll allow me, I wanted to change the topic a bit, and I think this would be best addressed by Dr. Vanderhoff. The governor this morning, his office announced that he has been exposed to COVID-19 from two staffers, I understand that he is feeling okay, not symptomatic, and he's tested negative. But I'm curious, since this has happened, have you had a chance to speak with Governor DeWine, what he has to say about this, and also what you think the fact that he's been exposed this late in the pandemic, what it says about kind of the status of things and where things stand in the state of Ohio right now?
Well, thanks for that question. Yeah, I think that this is about one of the best illustrations that we could have of why the message that we as four doctors are sharing today remains so important. And that is, look, vaccination is very, very important. And in addition to vaccination, during this time of very high transmission, when you are going to be around people, especially if you're going to be close to people and close to people in large numbers, you need to wear a mask. The governor has done all of that. And so as a result, he's acting out of what is clearly an abundance of caution and not only meeting, but exceeding quarantine recommendations, which is the right thing to do. As a leader, he is showing the way. But I think what his exposure demonstrates is that anybody can be exposed, including any vaccinated person. And that in this time period where COVID-19 transmission rates are still so very high, we're in the 300s in terms of cases per 100,000, with the threshold for being high around 100. So we're in the very high range. We have to be mindful of the context of the environment. And the environment now is one that has a lot of COVID-19 and COVID-19 transmission still in it. So I think if we had wanted a made to order example of why our message is spot on, this would have been it. Clearly, this was not manufactured, but just a natural illustration of the importance of getting vaccinated and then being mindful of one's environment and the importance in some circumstances of being masked, even if you're vaccinated.
Thank you, Dr. Vanderhoff. Our final question today comes from Jordan Laird with Dayton Daily News.
Thank you. So Dayton Children's is planning optimistically for 40% of its area children's 5 to 11 to get the vaccine, and teens continue to hover at around 43% vaccinated. That hasn't moved significantly in a while. So people are wondering, can we reach herd immunity if only 40% of 5 to 11-year-olds get vaccinated? Can you give a sense of where we are on the path to herd immunity?
Yeah, thanks for that question, and because I think it's a very, very important one. And it really speaks to the immunity that we are gaining as a state community against this terrible virus. First, we have to recognize that when we look at among eligible Ohioans who have received their first dose of the vaccine, so for everyone 12 years of age and older, as of this moment, we're very close to being at 65% of the population 12 and up who've gotten at least one dose of the vaccine. They're on the path. That's very encouraging. Now, layer on to that, when we look over the last couple months, it then becomes clear that despite the fact that for most of the people who are eligible and who are receiving the vaccine, vaccines have been available for quite some time, we're still seeing around 100,000 people a month come in and get the vaccine. Now, presumably, these are people who have been on the fence. These are people who've been reluctant to get vaccinated early on because they've had the opportunity, and yet they're continuing to make the decision, continuing to say, yeah, you know what, I think that is the right thing for me to do, which again is very encouraging. So we continue to see a steady stream of people receiving the vaccine in fairly substantial numbers. Now, as we layer on this next important age group, an age group who are out and about themselves a great deal because they go to school, it's further encouragement because if we are able to achieve substantial numbers of pediatric vaccinations, that's that much more of the population that is well protected and far less likely to spread the virus from one person to another. So overall, I'm very, very encouraged. We all, I think, as physicians, would like to see the vaccination rates be as high as possible because we believe this is good medicine. We believe this is the right thing for the vast majority of patients. We really believe it's the safest path for the vast majority of patients. Let me just pause there, though, and give my colleagues a chance to add any comments they might wish to add.
Doctor, if I can add to that, I think, both as a doctor and as a mom, one of the most heartbreaking effects that I've seen come with this pandemic and this infection has been kids and teens struggling with sadness and stress and anxiety and school upheaval and just hopelessness. So though we certainly recognize the importance of herd immunity to help broaden really the effectiveness of the vaccine in terms of our long-term protection of the community, even if individual vaccinations help get our kids back together with friends and family and loved ones, I think it's well worth it as well.
Dr. Vanderhoff, that's such an excellent comment from Dr. Dritz. I just want to piggyback on that because we've all paid a price during this pandemic. But as pediatricians, I think we really recognize the unique price that children have paid. School has been disrupted, their activities have been disrupted. This is their formative, developmental phase of life. And some of them may only have memory of life during the pandemic. Vaccination is a community service, as Dr. Forbes has pointed out, that public health is impacted by personal choice. This is a child's opportunity to actually contribute to helping us move out of this pandemic. And I fully believe that children lead the way quite often and can help us lead our way out of this as well.
Thank you. That was our final question for the day. Dr. Vanderhoff, if you'd like to share any closing remarks before we conclude the press conference, please feel free.
Well, thank you all again very much for taking time to join us for this briefing. And we are, again, very pleased with the ACIP and FDA Advisory Committee decisions regarding this new vaccine for this age group. And we look forward to seeing many of our children 5 to 11 years old gaining protection from COVID-19.